Hello! Today I want to take some time to discuss the different paths that you can take after dermatology residency. In other words, what exactly is it that a dermatologist can do after graduating? What is the huge range of things that we can do on a day-to-day basis as a practicing dermatologist? First, a thank you to Kalpana, who inspired this video with her comment. And so if you have other ideas for videos, please throw them in the comments below. I'm always reading them and always trying to think about how I can make another video to help answer the questions that all of you have. Let's just dive right in. As a dermatologist, you can do almost anything as it relates to the skin. Most dermatologists I know practice a combination of different aspects of dermatology. What I mean by that is that there are some people who focus on medical dermatology. These are the folks who are seeing patients with acne, doing skin checks, taking care of warts. And there's also people who focus on complex medical dermatology, such as myself. These are the patients who have autoimmune blistering disease, cutaneous lymphoma, or maybe complex rashes that happen in the setting of chemotherapy and other anti-cancer drugs. And there are also a lot of dermatologists who practice at the intersection of dermatology and other fields. So for example, with me, I practice at the intersection of oncology or cancer and dermatology, the skin. I have a lot of colleagues that practice in rheum derm, the intersection of rheumatology and dermatology, and again, a lot that practice at the intersection of infectious disease and dermatology. That would all fall under the umbrella of medical dermatology. Other than medical dermatology, there's obviously surgical dermatology. They're the ones taking skin cancer out, they're the ones who are removing cysts and lipomas. Dermatologists can take off gigantic lesions, gigantic tumors off of the skin. A great example of this is Dr. Pimple Popper or Dr. Sandra Lee. If you take a look at Dr. Pimple Popper's YouTube channel or even her show on TLC, it's a great example of what a well-trained, board-certified dermatologist can do. That is really surgical dermatology. Then there's folks who really practice cosmetic dermatology. These are folks who are using lasers, using injectables like fillers, or using neurotoxins like Botox. So these dermatologists really focus on the aesthetics of a patient's appearance, and they're really doing this largely through non-surgical means. However, dermatologists who focus on cosmetics can also do things like liposuction. They can do things like very deep chemical peels, some of which even require an anesthesiologist if they're really truly that very aggressive type of peel that we call a phenol peel. So those are the cosmetic dermatologists. Another group to know about are the dermatologists who like to read pathology slides. So these are folks who might want to take a biopsy specimen, have it processed in the lab, and then actually use a microscope to figure out what the diagnosis is. So these pathologists are so critical in making the ultimate tissue diagnosis for a lot of the things that we can't diagnose just from clinical exam. One other area to point out is pediatric dermatology. Pediatric dermatology is a little bit different in that, yes, you're mainly working with pediatrics. However, you can do all of the things that I discussed before, except probably not cosmetics, but just within a pediatric population. What I mean by that is that we have folks who do surgical dermatology in kids, or we have folks that really focus on medical dermatology in kids. In general, the field of pediatric dermatology is really focused on the medical aspect of dermatology in children or in young adults. And so just realize that even though pediatric dermatology we usually think of as medical dermatology, you can still practice dermatopathology within pediatric dermatology, or you can also practice surgical dermatology within the younger population as well. What's really important to know is that most dermatologists practice a mixture of these. So for example, myself, even though I consider myself primarily a medical dermatologist, I actually will do surgery every week, and so I do a mixture of medical dermatology and surgical dermatology. I don't read my own slides, but there are folks out there who are medical dermatologists, surgical dermatologists, and they will also read their own slides as well. They'll have them processed in the lab, sent back to them, and then they'll read their own basic slides. There are a lot of my colleagues who also practice cosmetics in addition to medical and surgical dermatology. I personally don't do any cosmetics. It's just not something that I have any interest in, but I have a lot of colleagues who are very interested in it, very good at it, and so I send all my folks to them. And so they're usually practicing a mixture of medical and cosmetic dermatology. What is most exciting about dermatology is that you are trained to do all of those things without a fellowship. So what that means is that at the end of your 3 years of dermatology training, you can actually go and decide to read slides. You can see kids, you can practice surgery, you can do all the medical dermatology, and you don't need extra training. because getting board certified in dermatology means that you've trained in all of those domains and you're able to take care of patients across the age spectrum and from start to finish. Just a reminder, I think the field of dermatology is so exciting because we truly own our organ system. We can go from diagnosing a skin cancer, biopsying the skin cancer, reading the pathology slides for that skin cancer, and then cutting it out afterwards. And that's all us. That's all us as a field. That can just be you as a dermatologist. Doesn't have to necessarily go to any other physician unless it's necessary because of the case or because you need help. One thing to mention though is that there are a lot of fellowships for folks who really want to zero in on one of these areas and practice primarily in that area. So for example, there are a lot of people who will do a pediatric dermatology fellowship. These folks really focus an entire year of their study on just seeing kids with dermatologic problems. And then within pediatric dermatology, again, you can subspecialize into one of those different areas as well. You can also do a dermatopathology fellowship, and a dermpath fellowship after dermatology residency means that you need to do a little bit of pathology basics. So that means that you have to go back and do some of the things that your pathology colleagues have done in pathology residency that you didn't do as a derm resident. But that said, you at the end of a year will be reading slides and practicing as a dermatopathologist. You can also do a Mohs or Procedural fellowship. So what this means is that after a year, you will be the one that will be sent all of those very complex surgical cases, the ones that are skin cancers on the face, the head and neck, or very large cancers that really require some expert management, meaning you're going to be doing a lot of flaps, a lot of grafts, a lot of closures that require a more cosmetic eye because you're doing a lot of that on the face. And rest assured, your patients will notice if they have a big scar on their face. So there's a whole year of training dedicated to being an excellent Mohs surgeon. Mohs surgeons also read their own slides because the whole point is they have to be able to tell where a skin cancer ends at the time of the surgery. So they're also focused on reading frozen sections in lab. The fellowships I just mentioned are all the ACGME accredited fellowships after dermatology residency. So to review, that's pediatric dermatology, dermatopathology, and Mohs and procedural dermatology. However, there are a ton of other fellowships that are out there that are not ACGME approved. That doesn't mean that they're not valuable. That just means that you don't necessarily get board certified in that particular subspecialty. So for example, even within our own system here, we have a fellowship for cutaneous lymphoma, a fellowship for rheum derm, rheumatology and dermatology. We have a fellowship for oncodermatology. We have a fellowship for complex medical dermatology. We have a fellowship for patch testing or contact dermatitis. The point is that if you do an extra year of training after your dermatology residency, it's pretty much called a fellowship. The reason to do it is because maybe there is a specific population, maybe there is a specific procedure, maybe there is something specific that you want to do a lot of in the future and you want that extra training for another year. None of these fellowships are required though. So as you can see, dermatologists do a ton with the skin. You can take a patient from start to finish with all of their skin disease, and that's one of the great things about our field, at least in my opinion. One other thing to consider if you're already in a dermatology residency is think about the strengths of your residency. The residency I went to was super strong in medical dermatology, specifically in the overlap of oncology and dermatology, as well as the overlap of rheumatology and dermatology. So from my residency program, almost no one will pursue a cutaneous lymphoma or an oncodermatology or rheum derm fellowship because we're already feeling sufficiently trained. However, if you came from a program that might not have that much exposure, that's when you might want to consider a fellowship. It's really a case-by-case scenario and a specific situation that you have to think about in terms of your relative strengths, weaknesses, and what you might want to practice in the future. I'll end by saying that for our patients, it's really important that they see a board-certified dermatologist. Dermatology is a very complicated specialty. Unfortunately, it's also a specialty where a lot of people think that it's very easy to practice. You don't really know how complicated the field is, and you don't really know what you're missing until you've done a dermatology residency. As much as I know that there are a lot of people out there who want to be dermatologists or who might want to practice dermatology despite not doing a dermatology residency, I do think it can get quite dangerous in certain circumstances. As future health professionals, I would just implore all of you that if you have a patient that has a skin condition, consider sending them to a board-certified dermatologist. And one of the easy ways ways to do that is to look at their name. Because at the end of the name, if they're board certified in the field of dermatology, they can list FAAD, Faculty of the American Academy of Dermatology. That's one way that you can tell a difference. With that said, I just want to end by saying good luck to all of you who are interested in dermatology and thinking about pursuing a residency in the specialty. I can't wait to be a colleague to all of you. Good luck with everything, and see you next time.